Hello, I want to welcome you to Working in Long-Term Care Facilities training presented by ViaQuest, Psychiatric and Behavioral Solutions. My name is Kimberly Weitzman. I am a QA and training manager here at VPBS, and I will be presenting this training to you today. Before we get into the actual training, I just want to take a moment to thank you, first of all, for the important and the hard work that you do with our clients who live in long-term care facilities. And just again, to remind you of the importance of the role that you play in our clients' lives. And not only are we providing a needed medical service to our clients who live in long-term care facilities, but especially now in times of COVID, we may be one of only a handful of people that are interacting with our clients and providing support and seeing them on a regular basis. So again, thank you for your importance and your hard work. And I hope that you realize how important your role is often in our client's life, both medically as well as providing some human contact and that social support that everybody really needs. Okay, so just like all of the trainings that you have been taking with these modules in the video form, I want to remind you that along with this training is a quiz that you will need to be completing. It's called the LTC Facility Training Quiz, and you see it pictured there on the screen. If your supervisor hasn't given you one, you may print one off from the O drive. Please, again, if you don't have this quiz, see your supervisor or see if you can't print it off of the O drive. In addition to completing that quiz as we go through today's training, you will also need to complete and sign the LTC Facility Training Acknowledgement Form so that you get credit for participating in this training. So again, as in other training videos that you have viewed, as we go along the way, you will find quiz reminders that will help you to complete that quiz and get all of the correct answers. Please hang on to that quiz because your supervisor very well may want to go over it, and it's also a good way to have important information from this training at your fingertips. Okay, so let's go ahead and actually get into the information about long-term care facilities. So you know what to expect. Today's training, our objectives are to learn how to build relationships as we work in long-term care facilities. We will go over some pros and cons of working in LTCs. You will be able to understand the different roles that people play in long-term care facilities depending on your position, whether you are a TBS worker, a therapist, a nurse practitioner, or a nurse. We all play an important part in our clients' treatment. We will review VPBS's reporting policy as it specifically pertains to long-term care facilities. We will review boundary setting and having professional behavior and professional relationships with our clients and coworkers as we're working in long-term care facilities. And then our last objective is to identify some common interventions that may be used as we're working in a long-term care facility. So our first order of business is to have a nice introduction into long-term care facilities from Kayla Bell. So I'm going to go ahead and play that video introduction from her, and then I will see you on the other side of that video.
Hi, I'm Kayla Bell. I'm the Director of Development and Business Operations for our Psychiatric Division. I'm here to talk to you about the nursing facilities that we're contracted with throughout the state of Ohio. Anytime you are assigned a resident at a facility or are going to be working in any facilities, we always want to make sure that we're checking in and out with whoever the point of contact is at that facility. For our nursing team and our nurse practitioners, it's typically the director of nursing or the DON. For our TBS and therapists, it's typically the social worker. So when you arrive, you'll just let them know which residents you're planning on seeing that day. That way they can let you know if there's any issues or concerns with those specific residents. That way you can address those during your session. For instance, one of them may have gotten into a fight with their roommate the night before, or maybe one of their close relatives passed away over the weekend. All of that information would be really helpful to you to know prior to going into your session with them. You will also want to ask every time you arrive if there's any new admissions or new residents at the facility that you can consent for services, or if there's any residents who are not on services that would benefit. If the facility tells you that there are, then you can just ask them to print that residence day sheet, and then you can go to and approach that resident regarding services. So a fee sheet looks like this. It would include the facility's name. It would include the resident's name, their date of birth, all of their insurance information. It would also notate their contacts. So if they have any guardians or if they do have a power of attorney, it would be notated down here under the contact section. So for instance, this resident, they had somebody listed as their legal guardian. Whenever they have a guardian or a power of attorney, we would need to get consent from that person prior to us providing services. So I would then call the resident, I would then call the power of attorney or the guardian to ask if we could consent for services. We can accept a verbal consent from the guardian or the POA. That is fine. If they do not have a guardian or a power of attorney, their face sheet may look like this. It may have the resident's name listed right here, and then the relationship says self, and the contact type says responsible party. So that means that they're their own person, as they say in the facility world. They're able to provide consent for themselves. They do not have anybody else who is over their medical decision making. So if that's the case, then you would be able to go to that resident's room. You can find the information right up here, and you would just be able to talk to them about services directly and see if they're interested. Whenever I'm consenting a resident, I always keep extra consent forms in my car, or I take them with me to facilities. That way, if there is anybody new needing services, then I can go ahead and get them consented. So what I do, I always only print off this informed consent and treatment form, which is the second page. And if the resident is agreeable to services, then I would just have them sign on the signature line. I usually write in their name myself, because sometimes if the resident is writing their own name, it's not always legible. So it's always best if you're able to write the name in yourself and then put their date of birth here, and then you can just hand them the form to sign and date. So what I normally tell the resident whenever I am consenting for services, it depends on the service that you're consenting for, but if we're consenting for TBS, I normally, go to their room and say, "Hi, my name's Kayla. I'm a nurse with ViaQuest, and we're a healthcare company that's contracted with this facility to provide some services to the residents. I wanted to stop by as we have a clinician who's going to be working with the residents here on different goals they'd like to achieve. They'll also be able to work on coping skills, do different games and activities, and give you somebody to talk to. This service is covered 100% by Medicaid. There's no cost. Is this something that you would be interested in?" If they say yes, then I usually just hand them that second page, that consent form, and have them sign it. If you're consenting for medication management services, then I usually just tell them, "Hi, I'm Kayla. I'm a nurse with ViaQuest. We're a healthcare company contracted to provide services to the residents here. I wanted to stop by as we're the specialists for residents who are taking a psychiatric medication to make sure that the medications you're taking are working okay. This service is covered by your insurance. Is it okay for us to have our nurse practitioner stop by next time they're here to check in with you regarding your medications? And if they answer yes, then I give them the consent form to sign on. Now, whenever I do hand them the consent to sign, I do usually give them again just this second page, and then I go back and complete this first page after the fact. I don't hand them this first page when I give them the consent, because if they see that you marked psychotic behavior and thought disorder and hallucinations or any other symptoms that the facility may be reporting the resident has, they may get, really defensive and, may not be agreeable to the service when they otherwise would. So I usually refrain from saying mental health or, you know, giving them a list of all the diagnoses that are on their chart or in their file, just because, again, there's just a negative stigma with especially the geriatric population when it comes to mental health. So I usually, phrase things as coping skills or therapeutic services or helping you with independent living skills, social skills, communication skills, all of the things that would be included and provided as a part of the service, but just not labeling it as, mental health, just because, again, they're not going to be as receptive if that's the very first thing coming out of our mouth when we go to talk to them. So then after they, sign the consent, you will go back and you would complete this first page yourself. The mental health symptoms, you can often find that on the face sheet under the diagnoses. So for instance, this person, they have major depression listed. So then I would just go back here and I could just select depressed mood. If they don't have any mental health diagnoses listed on their face sheet, then I would just ask the facility social worker or whoever your point of contact is, if there's any mental health symptoms that that resident is struggling with, especially, during COVID and, just being in a facility in general. It's very rare that there's not a resident going through something, whether that be adjustment disorder, having difficulty adjusting to life in a facility, or maybe the facility is reporting they have over sexualized behaviors or they're acting out towards some of the other males or females in the facility, or maybe they are having some anxiety or depression, but it's just not significant enough that they actually need a medication for it. However, they are still dealing with grief, or they are still having difficulty, adjusting to life in a facility, or whatever the situation may be. So there very well may not be anything listed on their face sheet. And oftentimes, whatever the diagnosis listed in terms of mental health is, it's not always accurate, just because the person providing that diagnosis is normally, the nurse practitioner or the medical PCP who doesn't specialize in psych. So even if they do have schizophrenia or bipolar or another mental health diagnosis listed, usually we find that, after we do the assessment, it's not always accurate. So don't go by, don't take the face sheet as, whatever is listed is 100%, or just because there's nothing listed doesn't mean they don't have something they're still struggling with. You can always just confirm with the facility. And then once we do the assessment, we'll give them our own diagnosis. So even if whatever you mark on this symptoms checklist isn't accurate, or they don't actually end up getting diagnosed with depression, maybe it's only anxiety or insomnia, that's okay. This just gives us a guide so that whoever is working or doing the assessment with that resident, they have something to go by. We may, work with a resident or form an assessment a little differently if we see they're having over sexualized behaviors or psychotic behavior as opposed to, difficulty sleeping. So it just gives us a little bit of insight as to how to best work with that resident. But when we do the assessment, we'll confirm the diagnosis ourselves. The other thing to keep in mind when working with facilities is, in addition to providing great clinical services, we also want to make sure that we're providing great customer service to the facility staff. The facilities are our client, they're our partner. So we need to make sure that, we're working and having great communication with the staff at the facility. Um, Ultimately, they're the ones that decide whether or not we're able to provide services there. And even if we're providing fantastic clinical services, if we're not having good communication with the facility staff, or they're not aware of the progress being made, or they're not being provided regular updates, so they don't know exactly, what we're doing whenever we go there, and they decide to terminate our contract, or not renew our contract, then we ultimately could have an entire team of clinicians that we're scrambling to find other work for. So, it is equally as important that we are providing great customer service to the facilities in addition to the clinical services, because that's why we are able to have our jobs, is by keeping these contracts and these facilities happy. So just keep that in mind too. If there's any issues or concerns that come up in a facility that you're not sure about, or that make you uncomfortable, or whatever the situation, definitely, check in with your supervisor. You're welcome to reach out to me at any time if you have any questions about the facility. Another difficult thing that happens frequently with facilities is they do often have a lot of turnover with their staff. And that can be frustrating because you may have a great rapport or great relationship with their social worker. You have a good process in place and things are going great. And then all of a sudden, you show up to work there one day and they're not there, or the entire team is no longer there, or the facility was bought by another corporation. And so they have a whole new team in the building the next day. Then you all of a sudden have to, adjust and figure out, how do they want the communication to take place? Maybe they want you involved in the weekly meetings. Maybe they just want you to kind of come in and do your own thing and stay out of their hair because they're super overwhelmed and are trying to figure things out. Each facility is just so different in how they operate. And then it is definitely frustrating whenever you have new staff, because the preferences of the previous administration may be different when you have somebody new that you're working with. And then you have to change, what you're doing a little bit in terms of that. So feel free, if you have any questions or concerns about the facilities, or if you need any guidance regarding, navigating any of the facility issues, definitely reach out to your supervisor, and then always feel free to reach out to me as well. We provide great clinical services, and we also just want to make sure that we're providing equally as great customer service too. So if you need to send me an email, my email is Kayla, Kayla B as in boy, ELL, at viaquestinc.com. You can also find my information in the ViaQuest address book if you search my name.
Okay, so hopefully that overview from Kayla was helpful to you as you are orienting yourself to working in long-term care facilities, specifically those that are contracting with ViaQuest. So Kayla did a great job of giving us a lot of good information, but just to make sure that we are clear on some processes that may be a little bit different for long-term care facilities, I'm going to one more time review the intake process just for clarity purposes. So if we are involved in the intake process with the new client, we want to make sure that we complete the specific referral form for long-term care facilities. We want to attach that face sheet that Kayla showed us from the long-term care facility. We would want to make sure that we fill out the consent form, and if at all possible, get that guardian signature if we can. If that is unable to be obtained in the beginning of treatment, we can get verbal consent over the phone. But don't forget that we have 6 months from the time that we have obtained verbal consent to get written consent. So get right on the process of getting that written consent from a client's guardian as soon as possible. A couple more reminders that the authorization form is not required in long-term care facilities unless you are releasing information to an external party outside of the long-term care facility. For example, a friend of the client or other family members of the client. It's best practices to still complete an authorization form, but notate on that form, no release given. So we know that you have at least considered the fact that there may be people to contact, but we have not identified any. We want to make sure that we send that entire intake packet to Kayla when you have completed the referral packet, if that is something that you are involved in. And if the referral packet happened to be completed by staff at the facility, we should send it to the email address that you see on the screen, pbsintake@viaquestinc.com. Again, pbsintake, all one word, @viaquestinc.com. So have that email ready in case you need to give it to staff at the facility to turn in that intake packet to VPBS. Okay, so we've gone over some of the paperwork, kind of the administrative aspect of getting clients initially involved in treatment. But once we've gotten them signed up, once we have clients informed consent or the guardian's informed consent, now we need to start thinking about building that rapport or building that relationship with not only the clients, but also thinking first about the staff at a long-term care facility. So please realize the importance of developing relationships with the other staff that you work with. It's going to benefit the clients. It will help with having a continuity of care. If we have good communication with those co-workers, really is who they are at the long-term care facilities, so that we can have the most up-to-date, accurate information about what's going on with the clients. We can hopefully either prevent crises or prevent problems, or we can resolve them earlier rather than later. The better our relationship is with our coworkers at long-term care facilities, that is going to increase the chances that we receive more referrals from the facility. And that not only benefits those clients who are receiving our services, but it also is a benefit to ViaQuest as well. And just in general, having good rapport and building good, positive working relationships with the staff members at long-term care facility increases that feeling of teamwork, that we are all working together, even though we're from different companies, that we are all working for the benefit of the client. We're all on the same side, we're all on the same team. We all want to support the clients as our roles determine us to support those clients. So lots of really good reasons, first of all, to build relationships right off the bat with staff at long-term care facilities. So let's start thinking about how we could do that. What are some things we can implement to have the best possible professional working relationships with those staff? Some things to think about are doing at least bi-weekly check-ins with those administrative staff that are points of contact at that particular facility where you are. In general, just be friendly, greet staff, introduce yourself as you're going around the facility, make sure people know who you are, make sure people know what you do, make sure people know how to get into contact with you. Maybe have your business cards in your pocket or in your purse so that you can give out that important contact information. Let the administrative staff know about any concerns that you might have in regards to clients. Again, let's be proactive about preventing issues or solving them as soon as possible. And the only way we can do that is if we let the staff know of any concerns that you might have about a client. Please, take some time to really learn the facility where you are working. Some facilities, as Kayla mentioned, prefer ViaQuest staff to be as independent as possible, and other facilities will operate in a way that they would like to coordinate with us more. And again, the only way to find that out is to communicate, is to ask questions, is to be available, and to be around, and to educate not only the clients, but educate the staff on your role and how you fit into the team at that particular facility. If you do happen to have any concerns about the long-term care facility where you're working, please always go to your supervisor immediately to address any concerns that you might notice. So let's kind of move on to thinking about what are some of the pros and cons of working in a long-term care facility. It's not like working in an outpatient clinic. It's also nothing like working with clients in the community. So there are some pros and there are some cons to address, especially if you have never worked in this type of setting before. It may be an adjustment for you professionally. So let's go through the pros first. Some of the positives of working in a long-term care facility are things like we can do small interventions. We can have the time to do things that other staff at the facility might not have the time to do, such as helping a client with organizing their closet. Initially, on the surface, that might not seem like that is a mental health intervention. But if a client is dealing with anxiety, or if they are dealing with feeling overwhelmed by adjusting to suddenly living in a long-term care facility, that could be a coping skill. That could be an independent living skill. That could be so many, beneficial skills that a client could learn or to practice simply by doing something like helping them organize their closet. So we have the time and the resources available to do things like that. Definitely is a pro. Another positive is that clients in long-term care facilities often have little external support, and we have the opportunity to be an additional source of support for them. This was true before COVID, and it is even more true now. They may not have seen their friends and their family for weeks, for months, maybe not even for a year. And so, please see how important it is to see the clients when we say we're going to be seeing them, and to remember that we might be their only or one of their very few contacts with the outside world. So definitely another pro and an important role that we as staff play in those clients' roles. Another pro of working in a long-term care facility is that you, as an employee, can have a flexible schedule. Clients are there usually 24/7, so we can have the flexibility to not only see clients when it is convenient for them, but maybe we can also enjoy a little bit of flexibility in our own schedule as well. Another pro is that the client has someone to listen to their concerns. Perhaps the regular staff at that long-term care facility are just, busy, or they have other duties, other administrative duties maybe to deal with. And while they do, listen as much as they possibly can, they don't have the time. They don't have an hour of their time to sit down and talk with the client and listen to what are their symptoms, to listen to what are they struggling with, or to listen to what are their successes on that particular day. But we, again, are afforded that luxury of having the time to really deeply and actively listen to clients about their experiences and to really hear what they have to say. Another pro of working in a long-term care facility is that we help our clients adjust and adapt to situations that they often have no control over. Chances are that that client did not, as their first choice, have, have their first choice to be living in that particular long-term care facility. Maybe that is where they need to be medically, or maybe that is one of only a couple options that they had available to them. They also don't have any control over COVID-19, just like we don't have any control over COVID-19. So we, again, play such an important role in helping them to cope with this situation that they don't have any control over. And we can provide that support to them. Maybe they can't choose who their roommate is. They can't usually choose what's for dinner. So their choices in their world is just getting smaller and smaller and smaller and smaller. But fortunately, we are part of their world, and we can provide that support and help them make the best of the situation that they're in. The last pro on this screen is that our presence makes their day. Just like I was saying, we come from the outside world. We bring news of what's going on outside. Hopefully our presence is helpful to them. Hopefully our conversations are therapeutic, and hopefully we are helping them. And so for those reasons and for many, many more, our presence really does make their day. Hopefully it is something they're looking forward to, somebody to talk to, somebody to listen to them. So I can't emphasize enough how important our role is in clients' lives, especially those who are living in a long-term care facility. But just like anything, there are pros and cons to working in a long-term care facility. So let's address some of those cons. The fact of the matter is that clients will pass away. We will be dealing with the death of clients. And that can take its toll on us professionally. That can take a toll on us personally. And so that's something that we will need to prepare ourselves for, be ready for as much as we can. And if we are struggling, please seek out your supervisor, seek out your coworkers, and even consider getting some help of your own, whatever that looks like for you. But definitely needs to be kept in mind that clients will pass away, or clients will move out of the facility, perhaps for another facility. One of the realities that is also a con of working in a long-term care facility is there is a high turnover rate of staff. That is just the nature of the business. And so like Kayla said, we may be getting to know many different staff over the course of working at a particular long-term care facility. Again, just something that we need to be prepared for. Let's have a plan for it. How am I going to introduce myself? How am I going to make sure that I stay in communication with the new staff? How am I going to explain what my role is? We can't do much about the staff turnover rates, but we can do our best to deal with it and do our best to make sure that the client care doesn't suffer because there is a high staff turnover. Just like clients really can't control a whole lot when they're living in a long-term care facility, there may be issues for us as contracted employees going into the long-term care facilities that are also beyond our control. We cannot change the menu for dinner or for lunch. There are things that are only under the control of the long-term care facility. And so we just have to do our best, again, to know what those policies and procedures and rules are at the facility where we're working, and speak up if it seems to be negatively affecting one of our clients. But that is another reality, that there are going to be issues beyond our control, not only with the facility, but maybe issues with our clients and their family, or with our clients and their friends. Again, we'll just do our best to get those releases of information, do our best to coordinate, do our best to support, but we can't change everything in our client's life. We'll have to pick our battles. Which is sort of related to the next con. There may be difficulty coordinating services. We may have to call resources multiple times. We may, because of turnover of staff, not know who to talk to, or not know who the new replacement social worker is, for an example. So we just have to keep going, and we just have to do our best when it comes to coordinating services, making sure that we are doing so for the benefit of our client. Another con is there could be some difficulty in creating interventions specific to the client's needs. We may be only limited to being in that long-term care facility building, and that might limit the interventions that we can provide. Physically, the clients might not be able to participate in some interventions that we might do with other clients who maybe are a little bit younger or a little bit more physically able to participate. We also, have to keep in mind things like roommates or, space available to meet in private with clients. So there's many different um, influencing factors that may make deciding on an intervention or completing an intervention with a client particularly difficult. But this is where we just need to get creative and use each other as a resource. Maybe your coworkers or your supervisors have some good tips on interventions that are more likely to be successful and therapeutic within a long-term care facility. So please reach out if you're struggling with this particular item. The last con is client resistance. As Kayla mentioned, the population that we're working with oftentimes in a long-term care facility may be of the generation that we don't talk about our problems. We don't admit that we have a mental health issue. So right off the bat, there might be some resistance to being open and honest, and verbalizing feelings might not come naturally to them. Also, perhaps clients are feeling, helpless and hopeless because they are in this facility, also leading to resistance. Why bother working on these issues if I'm stuck here in this facility? What can I really even do to improve my situation? So for many, many reasons, there may be some client resistance. They may also just not understand our role. They may not understand, why is this nice woman or man coming to see me a couple times a week? I think if we explain our role, if we explain the benefits that we could help them with, experience living in this long-term care facility, that may help reduce some resistance. Oftentimes resistance is a result of just not understanding or of not having the right information. But again, if you're running into resistance with your clients, please don't hesitate to go to your supervisor, and please don't hesitate to coordinate with staff. They may have a tip or a trick for relating with that particular client that might help you out. Okay. So let's talk about the specific roles at long-term care facilities and those specific services that therapists and TBS workers will be providing. We'll start there. So as you think about your role working in a long-term care facility, if you're a TBS worker or a therapist, we always want to start with creating realistic and measurable goals. We talk about this in many different trainings. We're going to also talk about it in this training related to long-term care facilities. So being realistic about what it is that that client can actually accomplish, taking into consideration their environment, where they're living, their mental capacity, their physical capacity, to set goals that they could actually, feasibly achieve, as well as being measurable. Just a reminder that we want to make goals measurable based on factors that they could measure even when treatment is over. So how many, for example, how many times are they going to take a walk per day, or how many panic attacks did they have this week versus how many panic attacks did they have last week? Things they can count, things they can measure, stay away from percentages and things that are hard to calculate. Another role of TBS workers and therapists in long-term care facilities is, again, to communicate problems effectively to nursing or administrative staff. So find out the best way to do that. Is that in person? Is that with a voicemail? Is that with an email? Find out how things work at that facility and do your best to really effectively communicate those issues ahead of time. Let's be proactive and not reactive. You TBS workers and therapists will be working independently sometimes in your role, and other times you'll be working collaboratively, as needed, depending on the client's needs, as well as depending on the facility's needs. So that requires you as a TBS or a therapist to be flexible and to also to get to know the lay of the land, so to speak, at the long-term care facilities where you're working. Your role also is to help clients to develop skills to adapt to their current situation. So probably working on coping skills that are meaningful and helpful to that client. And you'll get to know your client to find out which coping skills are helpful to help them adapt. You also will be monitoring symptoms, checking in on mood, checking in on triggers, checking in on environmental factors that seem to affect their symptoms. Ask those questions. Get curious about, when do they experience these symptoms? What does it look like when they say they're depressed? What does it look like when they're feeling manic, as an example? So really, we have, again, the time to monitor these symptoms, which can be valuable information, not only for the client, but also valuable information for their nurse practitioner or whoever is prescribing their medication. And then lastly, your role as a TBS worker or a therapist is to help clients develop skills to alleviate symptoms. So not only to adapt to their current situation, and not only to monitor symptoms, but to alleviate those symptoms. Could deep breathing help with panic attacks? Could a little bit of exercise help with depression? Again, you'll learn your clients, you'll learn those skills that are helpful to them, but that is absolutely a huge part of what you will be doing as you're working with your clients. So moving on to psychiatric mental health nurse practitioners and their roles. Very important role is to assess, completing that initial assessment of mental health disorders. Reminder that a mental health disorder diagnosis must be present if TBS services will be involved with the client, excluding an intellectual or developmental disability and substance use disorders. Another role of psychiatric mental health nurse practitioners is prescription management. We are looking to you to be the referral source for TBS as well as therapy services. So identifying those clients who could benefit from therapy or case management. You are responsible for seeing those clients every 1 to 3 months, making sure that we are closely following those clients and meeting with them as meets their needs. And you are also looked at as a liaison for issues in the facility. So be open to coordinating with the therapist, be open to coordinating with the TBS worker, be open to coordinating with administrative staff and other staff at the long-term care facility. Everything should be done for the benefit of the client, and you are seen as a leader or a liaison when it comes to resolving issues, or hopefully, again, addressing issues earlier rather than later with clients. As far as nurses in long-term care facilities, you are responsible for making sure that a client's medication management is occurring. You are monitoring their symptoms as well. You're providing education on the client's medications, checking in on side effects, educating them on what to expect for side effects, and educating them hopefully on their diagnosis. Maybe they don't understand what bipolar means. Maybe they don't understand what cycling means. That's where you come in to provide that education. Nurses also coordinate and collaborate with staff within the facility to, again, provide that continuity of care, to share information so that we can all be on the same page when it comes to supporting a client who has a mental health diagnosis. Your role is also to obtain vitals and to monitor those vital signs. Nurses will write orders for client medication, and nurses are also responsible for checking charts for lab results, monitoring new illnesses, as well as sicknesses. So again, another very important role that nurses play in client care, as well as coordinating with other members of the client's care team. Okay, so hopefully this next topic is a review for you, but it can never hurt to go over mandated reporting, abuse, neglect, exploitation when it comes to our clients. Just one more way that we not only fulfill our legal responsibility to protect our clients, but that we're following proper policy and procedure. So we'll start with a definition that abuse is the willful infliction of injury, unreasonable confinement, intimidation, or punishment that is resulting in physical harm, pain, or mental anguish, including the deprivation of goods or services that are necessary to attain or maintain physical, mental, and psychological well-being. So remember that definition of abuse can show itself in the form of physical, verbal, or sexual abuse. Abuse must be willful, meaning that it was in a deliberate act. And we are required to follow ViaQuest's reporting policy in regards to abuse. Exploitation can also occur. Oftentimes it is of a financial nature, which means somebody else is abusing their financial control over a client's money or resources. And then we also have neglect that we are mandated to report, which is the failure to meet an older adult's basic needs, including food, water, shelter, clothing, hygiene, and essential needs. So if you have concerns that are not reportable, please remember it is important that these concerns are addressed with the administrative staff at the nursing home or at the long-term care facility where you're working, as well as with your supervisor. Our specific policy as it pertains to long-term care facilities in regards to abuse, whether that's physical, emotional, or sexual, neglect, and financial exploitation, is that those are all considered reportable events. We have to report those instances, and the procedure is to first call the QA and training manager immediately within 1 hour of discovering that instance of abuse, neglect, or financial exploitation. If the phone call is not answered, please leave a voicemail. If this is your first time doing an incident report, please text before you call and include your name and state that you do need to make a report, but do not include any client information. Don't include a client name, don't include any kind of client identifying information in that text message. Step 2, if the QA and training manager does not respond to your phone call and text message within 10 minutes, you are going to then immediately contact the independently licensed supervisor designated in your region. That person will then advise you on what needs to be done and who you need to report to. Another reminder, no report should be made without calling Gabrielle Bryson, who is our QA and training manager, or the independently licensed clinical supervisor designated for your region. If you are to report, ensure that the report is made within 4 hours of discovering the incident of abuse, neglect, or financial exploitation. And lastly, the incident report form should be emailed to Gabrielle Bryson as well as your supervisor by the end of that day. So hopefully that was a review of our policy. Please remember, it is very important to follow this policy. And if you have any questions, please do not hesitate to contact your supervisor. Okay, so here are some good long-term care facility do's and don'ts, especially if this is your first time working in this setting. It can be good to know this information ahead of time. So we want to start with the do's. Do get to know the administrative staff at that facility and start to address minor concerns and provide updates as needed. I've said it before, I'll say it again. Let's be proactive and prevent issues or solve them earlier rather than later. Do approach the social worker and address clients' desires to move to another facility. We're going to be supporting clients to advocate or perhaps advocate on their behalf. Do provide coping and adaptation skills for stressors that are specific to living in a nursing home. Do check in with nurses or aides to coordinate services and gain updates. So we want to give information as well as get information from nurses or aides or other staff. Please do help clients achieve independence, like I said earlier, by setting measurable and realistic goals. What we don't want to do is don't contact the ombudsman or other agencies with client concerns. We only want to be working within the facility that we are assigned to. We don't want to work with the client themselves on moving them out of the facility. We want to make sure that we are coordinating and advocating, but not doing that alone with the client. Don't make false promises to the client. Don't promise something that you cannot follow through on just to make them happy or just to calm them down. That is only going to make more problems down the road when we cannot fulfill that promise. Please also don't overwhelm the other staff at the facility with minor problems. If you're unsure if a problem is minor or not, please again contact your supervisor and talk it over with them. They can help you decide what is a minor problem and what is something that really does need to be addressed with administrative staff. That last don't is to don't set unrealistic goals that the client is unable to obtain. Let's start small, build upon those small successes, and let's see success in that manner. Let's not set goals that are impossible for the client to obtain. We want to gain their trust. We want to, note their progress and make sure that it is something that they can achieve. Okay, so we're also going to talk about boundaries or professional behavior, having professional relationships. So it is very important as you're working at this long-term care facility to be professional and avoid crossing boundaries at your site. So let's first talk about physically. On your person, what should that look like? You should be wearing your badges. You should be wearing appropriate PPE. And your clothing should be business casual at all times when you're working at the facility. As far as what you yourself are sharing with clients, self-disclosure should be kept at a minimum. If personal questions are asked of you, we can always reiterate that that the session is about the client and not about us. You are there to help them. They are not necessarily there to help you. Please identify yourself as a mental health support. We are not friends. We are not family to the clients that we're supporting. If boundaries are crossed, we should remind the client that the relationship is professional and not personal in nature. And do it right in the moment. Don't let time go by. Don't wait until the next session. Don't wait until next week. Do it right there in the moment. If a client says that they love you, or if a client says that you're their boyfriend or girlfriend, or if a client says that you're their friend or that you're like a daughter to them, in a nice but firm way, we need to remind them that we are there as a mental health worker to provide mental health support. Please avoid using your cell phone during the session as well as throughout the hallways of the facility. We need to have our attention and our availability to be there for the clients when we are there in the long-term care facility. And lastly, be sure that interactions between yourself and staff at the facility are professional. Just like we're keeping professional relationships with our clients, we also want to keep professional relationships with those staff. So also, maybe not self-disclosing to those other staff. Let's keep it at a professional level and not at a friend level. So boundaries should start immediately. It is best to start with boundaries right off the bat because it's hard to backpedal and set boundaries after the fact. So verbalize those clear expectations with the individual and ensure that you will follow these expectations as well, and then actually do that. Communicate immediately and privately when boundaries have been disregarded. Ensure that boundaries are always followed and not just when conflict occurs. And you may need to give constant reminders of what those boundaries are. Multiple times throughout the day, we may need to remind a client about personal space. Multiple times throughout the day, we may need to remind a client that we're not their friend, we're there as mental health support. That is not being mean, that is having good boundaries, and that is being a professional. So some common mental health diagnoses that you may be encountering in your clients at a long-term facility include such as major depressive disorder, adjustment disorder with depression or anxiety, generalized anxiety disorder, schizophrenia, bipolar disorder, as well as schizoaffective disorder. So these are not an all-inclusive list, but these are some of the most common diagnosis that you may encounter. If you don't have experience, or if you need further education or information about those diagnoses, please don't hesitate to go to your supervisor. They can suggest trainings that may be helpful to you so that you do feel comfortable working with folks who have those diagnoses. Some examples of common interventions used in long-term care facilities are things such as music therapy, games of all sorts, aromatherapy, because that scent processing center in the brain is very easily activated when it comes to smells and scents. And that may be a way to trigger memories or to calm down clients, is by using scents and aromas. Puzzles and coloring can be therapeutic. It can help with clients who may have difficulty sitting still or may need something to keep them busy. Maybe we are using games in a therapeutic way, using therapeutic bingo, using Uno cards as a way to facilitate conversations. Meditation, progressive muscle relaxation, mindfulness are all things that can be done anywhere, including in a long-term care facility. Consider going to the website jeopardylabs.com to create your own game, to use that game to develop coping skills. We hopefully are getting outside, perhaps in a patio area if possible, to get some fresh air, to get a change of scenery. Maybe we are using interventions such as go fish or reading, word association, or how-to activities to help with memory issues or memory training. I've already mentioned mindfulness. Mindfulness is a great intervention that we can literally do anywhere. Self-exploration activities such as creating a family tree may be very therapeutic for certain clients, as well as working on deep breathing skills. What a great way to relax, again, anywhere, simply by focusing on our breathing and slowing down that breathing. Other interventions may include dialectical behavioral therapy with a focus on distress tolerance skills. Not much maybe can be done about the situation that they're in, but could your client work on accepting or understanding their stress? Or could they use distraction skills to cope and accept and understand the stress that they are living in? Consider checking out positivepsychology.com, which could provide other interventions to increase fulfillment in life, find meaning in life, find meaning in activities. Also check out therapistaid.com, which has tons of worksheets that would be helpful to work on anxiety, depression, and other diagnoses as well. Get creative. Let's use some art therapy. Maybe we have beads or other crafts that could be very therapeutic interventions. Sticker pictures, check out Amazon for those. Maybe we're teaching self-care activities, such as polishing our nails or taking care of our bodies in other ways. Using motivational interviewing can be a very helpful intervention by identifying strengths that the client already has, praising and reinforcing those strengths that they already have to overcome other barriers they're experiencing in their life. Cognitive behavioral therapy is another intervention used and beneficial for many different diagnoses and many different populations. So we are thinking about improving adaptive thinking, and that will lead to changes in behavior, leading to changes in emotions. So if we are working on cognitive behavioral therapy with a client, usually it is less focused on problem solving in long-term care facilities, because often there may not be much that can be done to solve the problem that they're experiencing. They need to perhaps reframe it, or again, using dialectical behavioral therapy, think about distress tolerance, accepting, understanding, or using distraction. And the last one there, social skills interventions. Think about the fact that your client is now living with people they have never met before, and maybe social skills are a struggle for them. Absolutely a valid and could be very therapeutic intervention to focus on coping skills. Okay, next topic is about monthly progress notes. So here are some reminders when it comes to progress notes completed while you are working with clients in a long-term care facility. First of all, please be sure to sign in each day that you are at that particular nursing facility. Remember that TBS workers and therapists should complete monthly progress notes for each client they are providing ongoing services to. And we want to be sure to use the long-term care facility monthly progress note template. I'll pull that up real quick so you can just see what that looks like so you're familiar with it. It says here, monthly progress note. It contains the services they received. Are they making progress? Yes or no? The goal from their treatment plan, and then a summary of their progress throughout the month. Was there a safety plan completed during this particular month? Yes or no? And if yes, we want to provide a summary of that safety plan. The clinician signs it and dates it. So it is a different form for progress notes for care provided in a long-term care facility. So make sure you use that particular form. You want to scan that form or that note into SmartCare and turn those notes into the facility at the end of each month. That is the process for monthly progress notes in a long-term care facility. So we went through some cons of working at a long-term care facility. So let's address some ways to reduce those cons, especially when it comes to burnout, when it comes to compassion fatigue, when it comes to dealing with the death of a client, when it comes to being frustrated with long-term care staff turnover. So self-care is very important no matter where you're working, but definitely very important if you're working in a long-term care facility. Deaths occur regularly, and they're occurring even more since COVID-19 has become prevalent. Staff turnover can be frustrating for both you and your clients. Feelings of helplessness can increase due to not being able to solve or assist with many of your clients' problems. It's very important to consult often with other VPS staff addressing these problems during your team meetings, and please talk to your supervisor regularly. Please engage in stress relieving activities when you find it is difficult to separate your work life from your home life. This is where we need to walk the walk as well as talk the talk. We need to practice what we are preaching to our clients and do some self-care stress relief activities for ourselves so we can be at our best to help our clients. And please also remember that there is nothing wrong, and it is even encouraged to contact EAP, our Employee Assistance Program, if additional assistance is needed to cope with these stressors. And please remember that those EAP services are also confidential. So please do not be afraid to reach out for help or for support, whether that's from your colleagues or your supervisors or by contacting EAP. Self-care is so very important. We cannot help others unless we ourselves are healthy. So that brings us to the end of this particular training on working in a long-term care facility. Please remember to complete that quiz, the long-term care facility training quiz, sign it, and you will be going over that with your supervisor, as well as to complete the long-term care facility training acknowledgement form. So you get credit for attending this particular training. Unfortunately, I'm not there with you in person, obviously, so I cannot address your questions myself, but do not hesitate to contact your supervisor with any questions that may have come up through attending this particular training. So I appreciate your attention. And I again, thank you for the very important work that you're doing with our clients in long-term care facilities. So thank you very much. And I hope you have a great day.